Tonight I'm going to talk about a story, about a project that was led by a small group of designers who used design to improve the lives of people affected by dementia. Dementia has a devastating effect on people. For those of you who don't know that much about it, it progressively affects the brain tissue and many functions that we all take for granted, such as communication skills and memory, loss of memory, which I guess is quite well known. But it's not only those with the disease who are affected by dementia, those who are in the role of care and especially informal care, so family and partners of the person with dementia are also affected, because somebody with dementia can live for up to 12 years from diagnosis. Now, dementia is not only a country-specific issue, it's a global one too. In 2010, there was a launch of a report called the World Alzheimer's Report. This was the BBC reporting on that launch, and it stated that almost 36 million people around the world have dementia, and that's quite a big number, because that's actually more than the population of Australia, if you think about it that way. And that the cost of dementia to our societies by the end of 2010 could have topped 1% of the world's GDP. So lots of people, lots of money, and basically what the report was trying to get at was that we can't really expect anything less than truly innovative responses to how we meet the future challenges of dementia. So a year before the World Alzheimer's Report was released, in 2009, the UK government published this strategy. It's called the National Dementia Strategy. It's the front cover there, and this is sort of the UK government's way of like future-proofing this issue, this massive issue, growing issue with dementia. And in the strategy, there are 17 recommendations which say if these 17 were implemented, the lives of people with dementia and their carers would be significantly improved. And this is a really important document because it's one of these 17 recommendations that was inspired by what started out as a small design project in 2007. That's what I'm going to talk about today. And this project was called Alzheimer's 100, and it was led by designers from a social design agency in London called Think Public, who some of you might have heard of before. And they worked with a UK charity called the Alzheimer's Society to co-design ideas for what the future of dementia care could look like. And this project was one of 7 that came under a design innovation program that was founded by the Design Council in London. And this program was called DOTT07. DOTT stands for Designs of the Times, 2007. And I'm not going to talk about the other projects today, but that's just to give you a context for where this project emerged from and how it was funded. Now, instead of taking you through the project in heaps of detail, I'm just going to show you a short 3-minute film.
That's it.
My name is Alan Wager, and I can't remember what I... Memory's terrible.
You know, you get good days and you get bad days. Everybody, all of us, you know that you've got Alzheimer's. And it's, what gets me is it's, when you get the bad days, and you can have like a big, you know, it's not very nice.
Things are done for years and years, well, all one married life. You just cannot do it.
A lot of people probably don't know that they have these groups. I don't know how many groups there are.
The Alzheimer's, the Benefit Enquiry Line, Disability Gateshead, Gates of Carers Association.
We missed out on a lot of that. I didn't have any support from any of the agencies that you can get if you know the right people.
I'd like to see people being able to partake in decisions more frequently about their care, and more importantly, being able to have some impact upon decisions before it becomes a crucial or essential or even a crisis.
Everybody's a little bit nervous, you know. We're all saying about creating or designing a service, kind of now, you know, you think, well, actually, you could do this, you know. We have actually got the abilities and the skills and the power, if that's not too strong of a word, to actually go out and change services and provide services for people.
If you're going to give something to somebody to use, it's got to be useful to them. And therefore asking them to help you design it has got to be the best way to create something that is useful and meaningful and actually has some longevity.
So the Alzheimer's 100 project resulted in a number of innovative ideas for dementia care, and this was the key idea that came out of the project that was touched upon in that film. And it's just a proposal. At the end of the project, it was sort of at this conceptual stage, and it was a proposal for a dementia signposting service. And this was in response to some of the discussions and feedback you may have noticed in the film, where people were confused and didn't know about the dementia services and support that were available to them. So basically, the dementia signposting service responds to that by providing people with dementia and their carers with a person or a signposter who meets with those affected by dementia face-to-face and understands their specific needs and provides guidance on and signposts them to appropriate support and care throughout their journey of dementia. And key to this project, so working backwards from this, was the approach of co-design, what we just heard in the previous presentation, where designers didn't just design for people, but design with them as well. So that means involving stakeholders of an issue throughout the entire design process, from diagnosing the problem to generating the ideas and to implementing them. And co-design uses the methods from the designer's toolbox to inspire the creativity and collaboration of people and involve them throughout that process. For example, in the Alzheimer's 100 project, designers use their designer communication skills to invite the participation of people. So this was like a brochure that was like a call out to anyone who wanted to participate in the project. Designers also shared their creative skills in filmmaking with people with dementia and their carers. So you might notice some of the guys in the film in this shot, to co-design a 15-minute film that told the story of what daily life with dementia was like. And the film that I just showed you was actually a 3-minute cut of the 15-minute film. So some of that footage was actually taken by people affected by dementia. Designers also hosted a co-design day to bring together all the stakeholders of the issue to design what the future of dementia care could look like. And out of this day came the signposting service. And designers also helped prototype these ideas to see if they were possible to test and refine them, and to see if they would fit in the lives of the people who this issue would affect. And finally, designers provided continuing design support to help realise and make these ideas happen, such as the dementia signposting service. And it would be this service idea that would inspire one of the 17 recommendations in the UK government's National Dementia Strategy. And this was the recommendation. It was actually Objective 4, and it reads, a dementia advisor who provides easy access to care, support and advice to those affected by dementia. So in the National Dementia Strategy, the signposting service was actually renamed Dementia Advisors, and after the project, after the funding from DOTT was complete in 2007, 2 years later, Think Public were invited to continue their work with the Alzheimer's Society to pilot and then implement their idea. So the service was renamed Dementia Advisors, and this is some pictures on the left of advisors, and on the right a handbook that the advisors use in their support for people with dementia and their carers. So the Dementia Advisors idea is exactly the same as the signposting service, where an advisor supports people with dementia and their carers throughout their journey with dementia. And this service, since 2009, has been, I think starting from 2010 actually, was piloted and implemented across the UK, and has actually subsequently been evaluated by the National Dementia Strategy with quite positive results. So it's I'm not really following the project anymore because my research into it has completed, but I think it'd be interesting to see where this service evolves and where this takes people who are affected by dementia, you know, having begun as a small design project in 2007. So Alzheimer's 100 was a project, one of 7 projects of how designers are using design to tackle big social issues. I know tonight is about ageing, but other projects that I looked at in my research, my PhD research, were around health, education, energy, food, mobility, employment, and local communities. And there's no doubt there's probably many more areas, and I'm sure there'll be other sort of theme nights like this to discuss a lot more projects where design can have such an impact. And you know, I kind of think of the Alzheimer's 100 project and the other 6 projects that I looked at as sort of a building collection of case studies and evidence that can not just inspire but also really show how designers can help tackle society's biggest social issues and challenges. And that's it.